I'm Dr. Thomas Bierstedt. I'm neurosurgeon and spine surgeon. I offer a wide range of conservative, minimal invasive and operative treatment options for patients with spine problems. My main emphasis is the operative treatment for patients with chronic neck or chronic low back pain. In this field, my special point of view is to treat patients with artificial disc replacement and other motion preservation technologies. Over the last decade, I have collected a vast experience in diagnosis, indication, and surgical solution. It is essential to choose the right and adequate candidates for a successful motion preservation surgical intervention. I also address the entire cervical and lumbar spine, including the higher lumbar levels in the thoracolumbar region. It is important to choose the right approach, the optimal implant type, and the right surgery technique in order to achieve an excellent result. My goal is to alleviate pain for those who have been suffering from a spinal disease. In fact, most of my neck and lower back pain patients exhausted multiple therapies approaches, lost trust, confidence, and developed frustrations. Many almost lost hope and seem to have accepted to live pain and agony. Often that is not necessary. My goal is to find the actual cause of the pain and offer a corrective spine surgery, ideally preserve the natural motion and flexibility of the spine as opposed to fusion techniques. However, most cases are illegal for this. There are some very clear contraindications for these technologies, but mostly I can promise a therapy without fusion. Fusion is principally not a wrong or even obsolete procedure. Many spine surgeons still consider it as the golden standard. But from my point of view, motion preservation is superior to fusion if applicable. Nobody would fuse a hip joint. I consider the spine as a long chain of little interactive joints. In case of a structural damage, the prime goal should be to repair and to prevent motion. Goal is to bring patients to a normal life, without restrictions. Participate in all aspects of life, including professional, private, and leisure time activities. Of course, after an adequate time of healing and recreation. And also keep in mind that these technologies prevent adjacent level disease. My goal is that the next spine surgery should be the last one. This is the philosophy I stand for.